Hi everybody. So I once again welcome you to this new approach of DBMCI, the integrated sessions of one subject with another with a vertical integration and a horizontal integration. You have seen a lot of such videos, radio pathology, radio orthopathology. So continuing with this series, today me, Dr. Rajat Jain, along with Dr. Ashwani, will be talking about a very difficult topic for the student point of view, understanding the subarachnoid cisterns and its practical implication. So we will be talking about the radioanatomical insight on subarachnoid cistern. So we'll be starting with the anatomy and then we'll be discussing the radiological and the clinical part of that. So Dr. Ashwani.
Thank you, Dr. Rajat Jain. So before we start with the anatomical insight of this cistern, let's have a very basic outlook at this. When you say cistern, we are actually talking about the subarachnoid spaces. Usually pia mater is the most faithful layer of the brain, goes along with every gyri and sulci. But the arachnoid mater, it jumps from one elevation to another elevation and leaving these some major spaces that you see around the brainstem, and that is called as cistern. Now in the series, let's start with the cistern which are present in the lower part below the cerebellum and behind the medulla oblongata, called as cisterna magna, and it is also called as a cerebellomedullary cistern. As you can see, it is present between the inferior part of the cerebellum and behind the medulla oblongata. This cerebellomedullary cistern or cisterna magna, it's a larger cistern as the name suggests, and the content of this cistern includes the initial part of the vertebral artery. It contains a branch of the vertebral artery, which is one of the most tortuous artery in the human body, the PICA, the posterior inferior cerebellar, and 9th, 10th and 11th nerves are also seen. Just to have a more insight of this cisterna magna, if we see the brainstem in the lateral view, now you can see, here's a picture which is showing the vertebral artery. Now these dotted arrows are telling you, these dotted circles are showing you the region of this cisterna magna. As you can see in this picture above, you can appreciate the vertebral artery and the branch of the vertebral artery which is going backward, the posterior inferior cerebellar, the content of this cistern. And I'm sure you can appreciate this olive in this picture below, and you can see the nerves which coming out lateral to olive, the 9th, 10th and 11th nerve are also considered the content of this cisterna magna. Moving on from this cistern, the next cistern is the one which is actually connecting the cisterna magna behind to the cistern in front, that is Prepotine cistern, and that is called as the CP angle cistern or Cerebellopontine angle cistern. It's a paired cistern, you can see it both the side. So this arrow here, this animated arrow is showing you how the cistern is connecting the cistern behind and the one in front. Now this cistern is having an anterior inferior cerebellar artery, and we have the 5th, 7th and 8th nerve. Just to again have more of an anatomical insight of this cistern. Now this picture is again showing you the same, the lateral view of the brainstem and cerebellum. Now you already saw the cistern in this lower part here. Now look at the cistern which must be present in there, and again the arrow is showing you how the cistern is running from posterior to anterior, and you can see that it is connecting, it is having this anterior inferior cerebellar artery, one of the branch of the initial part of basilar artery, and we also have these 3 nerves to be seen here, that is the 5th nerve, the 7th nerve and the 9th nerve, 8th nerve is there.
So you have seen the anatomical part of the images. Now let's look at all these cerebellopontine angle cisterns in a radiological section. So as you could see that these are the transverse sections of the brain taken at the level of cerebellum, and this structure that you could see is the pons, and this structure that you could see is the cerebellum. All this white thing that you could see is the CSF, and this area is a Cerebellopontine angle cistern. As the name says, Cerebellopontine angle cistern. Okay. Now all that you could see is this black structure that is going anteriorly is the 5th cranial nerve, which has to go anteriorly. Whereas if you see a section slightly lower down, that you could see the 2 nerves that are going laterally towards the internal ear through the internal acoustic canal are the 7th and 8th nerve complex. Okay, so the 5th nerve, as Dr. Ashwani told you, going anteriorly, and the 7th and 8th nerve going laterally. Okay, nobody should ask you this tiny vessel that you could see here is the AICA, anterior inferior cerebellar artery. Okay, but the nerves are more important than the small vessel in this particular area. So the vessel that is the nerve that is going anteriorly is the 5th cranial nerve, and the two nerves which are going laterally towards the internal acoustic canal are the 7th and 8th nerve complex. Now what is a very important disease that you see in this particular area? Yes, just think about that. So can we see that? Now G, see this. This is a tumor, as you could see, going into the internal acoustic canal and forming a large lobulated, a typical what you say is an ice cream cone appearance. So the commonest tumor that is seen in the region of the CP angle cistern, the patient presented with tinnitus or hearing loss, is vestibular schwannoma, and we know that the vestibular schwannoma commonly originate from the inferior vestibular nerve. Contrary to the previous belief of the superior vestibular nerve, it originates from the inferior vestibular nerve. And a typical ice cream cone appearance, not on one side but bilateral. So this is a case of bilateral vestibular schwannoma, a case of neurofibromatosis type 2. Neurofibromatosis type 2. So the knowledge of the anatomy here, that this is a cerebellopontine angle cistern, and knowing that there is a tumor, you can correlate the two and you can mark it that this is a case of a vestibular schwannoma.
So moving on this series of the cistern, as Dr. Ajay told you about the CP angle cistern, now we move on to the more anterior part and the cistern that you see present in front of the pons, that is called as a Prepontine or simply the Pontine cistern. Now this Pontine cistern is having a major blood vessel, that is a basilar arteries there, and few blood vessels, few arteries which are originating from the basilar artery. Like you can see the origin of the anterior inferior cerebellar artery, the same anterior inferior cerebellar artery that we just saw in the CP angle cistern. So you can see the origin of that artery here. You can see the superior cerebellar artery, which I'll show in the next section. And we can also see the only cranial nerve coming out from the dorsal aspect of brainstem. That is a fourth. You can see the nerve coming out at the pontomedullary junction, very close to the midline. That is a sixth nerve. Okay. Now this is a picture which is showing you the same lateral view of the brainstem and the cerebellum. Now again, this dotted circle here represents the structures which are shown in this pre-Pontine or Pontine syndrome, Pontine cistern. We have this basilar artery. You can see the origin of this anterior inferior cerebellar artery from there. You can see in the upper part, that's the origin of the superior cerebellar artery. And look at that nerve, the sixth nerve, which is marked here, which is present at the pontopyramidal junction, or you can say pontomedullary junction, very close to the midline. And that's why you see in the cistern, which is close to the midline itself. Now from here, if we move on to the radiological insight of this cistern.
Now see the same section what Dr. Ashwini has showed you in an anatomical specimen. Now let us try to see the same specimen on a sagittal T2 weighted MRI in this. So as you could see in this particular image, so this is the brain stem that you could see, the midbrain, pons and this and the medulla, and anterior to that you could see is the prepontine cistern. Okay, so that you could see the prepontine cistern. I hope all of you can see this black color vertical line. So we know that on a normal spinaco images, the vessels are seen as flow voids. So this is nothing a vessel, and the most important vessel that you could see in a prepontine cistern is basilar artery. So this large vessel that you could see here is nothing but the basilar artery, as you could see going into the prepontine cistern.
So moving on from the cisterns that we saw present in the lower part, the cistern which are present around the pons and the medulla oblongata, let's move on to the cistern which are present around the midbrain, and that's why the group is called as a perimesencephalic cistern. Now we have this 4 cistern in this group. Starting from the posterior part, we got a cistern here. We have a cistern in front, and we have the cistern which is connecting this posterior and the anterior cistern here. So starting with the cistern that you see present below the splenium of the corpus callosum and above the superior surface of cerebellum and behind the midbrain. Now as we all know, the dorsal aspect of midbrain is having the 2 superior and the 2 inferior colliculus, and together we call them corpora quadrigemina. And that's why the cistern is also called as a quadrigeminal cistern or superior cistern. So that's the cistern which is marked in there. And this quadrigeminal or superior cistern, where you can also see the pineal gland is also projecting into it, is also called as a peripineal cistern. What is there in this quadrigeminal cistern? Now this cistern is having a vein called as a vein of Galen, also called as a great cerebral vein, which is formed by the basal vein of Rosenthal and the internal cerebral vein, which I'll show in the next section. We all have the third segment of the posterior cerebral artery, the P3 segment. P2 and P1 segment will be seen respectively in the next cistern we'll discuss. And we also have the lateral and medial branches of the posterior choroidal artery, which itself is a branch of posterior cerebral artery. Now, from this cistern, from this, the quadrigeminal cistern, if we move toward anterior from the side of the midbrain, that cistern is called as an ambient cistern. Now, this arrow here, this animated arrow is showing you the location of the ambient cistern. And to see what structures are there in the ambient cistern, it's better we look into the transverse section. Now you can see first, if we just enumerate the structures here, we have a posterior cerebral artery, that's a P2 segment. We just saw P3 segment is here, so we have a P2 segment in there. We have a superior cerebellar artery. The origin was seen in the pre-Pontine cistern. Now we are looking at the further course of the superior cerebellar artery here. The basal vein of Rosenthal and the fourth nerve, the trochlear nerve, which will be coming out from the dorsal aspect of brainstem at the level of inferior colliculus. So look at this picture here where you can see the midbrain. For your orientation, let me tell you, this is the colliculus part here. Then we have the peduncles here. And you can see this on the side, look at these animated arrows here. They are showing the location of this ambient cistern here, where you can see this vein is called as a basal vein of Rosenthal, which along with this internal cerebral vein forms this vein of Galen, which we just saw is present in the cistern behind, that is a quadrigeminal cistern, which ultimately is draining into the straight sinus. From here, we move on to the same ambient cistern. If you see it from the lateral view, you can again appreciate the two blood vessels there. Now that's again the area of the ambient cistern connecting the cistern behind and in front. And look at these two arteries there, the P2 segment of posterior cerebral artery, and you can also see the superior cerebellar artery present in there. From there, we finally move on to the cistern which is present in front of the midbrain, and that cistern is present between the two peduncles of the midbrain or the two crusts of the midbrain. That's why we call it interpeduncular cistern here. Now, to see the interpeduncular cistern, if you look at this, the ventral aspect of the brainstem, this is the interpeduncular fossa, and that's the region of the interpeduncular cistern also. In many books, they mention that the circle of Willis is the content of this interpeduncular cistern, but it's actually, more specifically, it's a component of the circle of Willis which is to be seen here. Like we can see the basilar artery, the terminal part of basilar artery, which is dividing into the terminal branch, that is posterior cerebral artery, and you can see the third nerve, which is one of the content of interpeduncular fossa as well as the content of interpeduncular cistern as well. Some branches of posterior cerebral artery called as the perforating branches are also to be seen here going into the posterior perforating substance. So these are the contents which are present in the interpeduncular cistern. So overall, all the cisterns that we saw here around the midbrain, we call them collectively as peri-mesencephalic cistern.
Yeah, Dr. Ashwini very rightly said that in some of the books it is written that the circle of Willis is present in the interpeduncular cistern, but the student have to understand it is only the part of the circle Willis that is present in, because that is one doubt that even I get a lot of time in my class, that we have been told that the entire circle of Willis is present in the interpeduncular cistern. So I have to tell them that no, it's just a part of it. It's a posterior part of the circle of Willis that is predominantly present in the interpeduncular cistern. Okay, so very, very beautifully describe the peri-mesencephalic cisterns. So now let us see all those cisterns on a radiological image. So this is a transverse section taken at the level of midbrain. So all that you could see, this structure that we all could appreciate is the midbrain, and what Dr. Ashwini has shown a transverse section that is almost similar. That's, you could say, a collicular part, and this is the crus cerebri. So the cistern, this black CSF containing space that you could see down here, is the quadrigeminal plate cistern, whereas between the two crus cerebri, the cistern that you could see is the interpeduncular cistern, and this is the lateral part which is connecting the two is what is called as an ambient cistern. Okay, that's an ambient cistern. Now if you're gonna go forward, now you could see the CSF space going between the two interhemispheric fissure, which is called as interhemispheric cistern if you want to label it at, and the lateral CSF space that is predominantly going towards the Sylvian fissure. Okay, so that's a Sylvian fissure. Now the significance, as he rightly mentioned, that the major part of the posterior cerebral artery is lying in the ambient cistern. A basilar artery is coming from down from the Prepotine cistern, and it is dividing at the level of interpeduncular cistern. It is dividing into two PCA. So the origin of the PCA is lying in the interpeduncular cistern, and then where it is communicating with the posterior communicating artery, the rest everything is the P2 segment that is present in this ambient cistern. And posteriorly, we have got a quadrigeminal plate cistern. Now, what is the clinical utility of this? Now, let us see an image. Now see what is happening. All that you could see, this is now not a CT, this is an MRI section where you could see, you could all appreciate the midbrain so well. And now what I see is, look at all these peri-mesencephalic cistern. They are showing marked exudates. Now the peri-mesencephalic cistern and along with all these other cisterns, they are collectively called as basal cisterns. Now in a patient with meningitis, when you see such pattern, this is a classically what is called as basal exudates. And when you see these basal exudates in Indian scenario, the first disease that comes to our mind is a tubercular meningitis. So that's a classical MRI appearance enhancing basal exudates in a patient with tubercular meningitis. Now in exam like AIMS, now if they give you an immunocompromised patient, or a risk behavior of an immunocompromised patient like a truck driver or a drug user, then you should think of the diseases which are specific to the immunocompromised patient like a cryptococcal meningitis. But otherwise, a non-immunocompromised patient enhancing basal exudate, the first disease that should come to your mind is tubercular meningitis. Okay, let's see one more image. Now what is happening in this? Now if you see, this is a slightly up section, but still you could see a quadrigeminal plate cistern and the lateral part is an ambient cistern. Now what you could see is an aneurysm over here. Okay, that's an aneurysm. We will be discussing that in a separate integrated video why it's an aneurysm. But if it's an aneurysm and the examiner asks you which vessel from which this aneurysm is occurring, now immediately it should come to my mind there are two important components here, a posterior cerebral artery or a basal vein of Rosenthal. The aneurysm will be from an artery. So this is a posterior cerebral artery aneurysm. Now why this is important? Now if you see blood in this area, we know it's a subarachnoid space and the blood is in the subarachnoid space. It has to be a subarachnoid hemorrhage. Now the examiners are very fond of asking these kind of question. There is a blood in the ambient cistern. Which aneurysm you are most likely to be seen? So this is a PCA aneurysm. Okay, PCA aneurysm. But here is a small catch. Sometime the most common cause of atraumatic SAH is rupture of Berry aneurysm. However, in approximately 5% of the cases of subarachnoid hemorrhage, it is not an arterial bleed, it's a venous bleed. This venous bleed usually stop of its own. And if it's a venous bleed, the vein that is involved for this venous bleed, you all know from your anatomy knowledge that this is the basal vein of Rosenthal. That is coming. So that is how your anatomical knowledge will be important. Now, if you want to solve a clinical question or if your radiological question like that, if your understanding is right, your thought process is right, you will be able to do that. Okay.
So guys, moving on to this this series again, we have done with the cisterns which are surrounding the brainstem part. Now, if you can see this cistern, we already saw that is the interpedimullar cistern, which you can see anteriorly it is communicating to the cistern which is called as supraselar cistern. It is present above the sella turcica and you can see it is communicating with this optic chiasma, so we can also call it the chiasmatic cistern also. So that's the cistern here called as a suprasellar cistern or chiasmatic cistern.
Okay, so we know a suprasellar cistern, and now let us see in a sagittal plane what is happening is, we know that in a sagittal plane this is pituitary gland, and what Dr. Ashwini just discussed, that it was just above the sella, and that is why this is called as a suprasellar cistern. If we see a mass in the region of the suprasellar cistern, the first mass that came to my mind is a craniopharyngioma. Okay, now so this is again, you know from a pediatric or a surgery knowledge that the most common mass located in the suprasellar cistern is a craniopharyngioma. So the knowledge of the cisternal anatomy will help you in picking up the right amount of knowledge at that particular space.
The next picture that you're looking at the ventral aspect of the brainstem along with the inferior aspect of the cerebrum as well. Now you can see from the internal carotid artery, one of the direct branch of internal carotid artery is running toward the lateral side in the sylvian sulcus, and you know that sylvian sulcus, it actually emerges on the lateral surface of the cerebrum where it divides into the three divisions here. So the major content of this sylvian sulcus or the cistern there called as sylvian cistern, in the deeper part of the cistern we have the middle cerebral artery. For the radiological insight, Dr. Jat will tell you more about it.
Now see a patient. Now what is happening? Now there are two cases that I am going to show you here. Now we all see that there is a subarachnoid hemorrhage that you could see, and there is an interhemispheric bleed going into the sulcal spaces over here. All these are the two lateral ventricle, and you could see that the aneurysm lying between the two lateral ventricle, and that is what is called as an area of septum pellucidum. Okay, so immediately it comes to my mind that there are two direct branches of the internal carotid artery. One is going laterally, which is the middle cerebral artery, and one is going anteriorly, which is the anterior cerebral artery. The two anterior cerebral arteries are joined by each other in the midline by the anterior communicating artery. So the moment I see a bleed in the region of the septum pellucidum, the first vessel that should show the aneurysm that should come to my mind is the anterior communicating artery. Okay. Similarly, if I see the blood in a different area, if we just switch onto the next image, now here I could see the blood into the sylvian fissure. And as Dr. Ashwini has just showed you an image where that middle cerebral artery was going laterally in the region of the sylvian fissure. So that means now this is not anterior communicating artery. Now the bleeding is coming from the middle cerebral artery aneurysm. Okay, so middle cerebral artery aneurysm. Okay, guys, so that is how that your anatomical knowledge will help you in solving the tricky questions that we are getting in the exam. Now, as we say that is how we always wanted the exam to be. Now, because we have always believed that a student should understand what he's reading rather than just mugging up and becoming a parrot and just reading the things. If your understanding of the subject is right, I feel that it does not matter whether it's a one-liner, whether it's a clinical question, whether it's a NEET exam, whether it's a next exam. apple will remain an apple. If your understanding of the subject is right, you will be able to do that. So we will be doing a lot more integrated videos of different sections. If you like them, please in a comment section you can share with us that any special topic that you want us to record: anatomy surgery, anatomy radiology, anatomy pathology, radiology medicine, whatever the special topics that you feel difficult, please write it in a comment section, and we'll be happy to make more integrated videos. You're gonna see more of such topics in the eGurukul app. Some of them will be available onto the YouTube. And just keep reading, give us the feedback. If you like them, subscribe to the channel, give us a thumbs up, because that gives us motivation to record more such videos.
Thank you.
Thank you.